We're here at St. Croix Orthopaedics with Dr. Bill Schneider talking about arthroscopic shoulder surgery. Easy for me to say. Back in the day, it wasn't as simple as it is today.
No, it wasn't, as a matter of fact. In the old days, we used to have to open the shoulder up, and in order to get into the shoulder open, we have to make a big incision, and then we have to stretch the muscles and other soft tissues out of the way so we can actually operate deep in the shoulder. Well, that causes a tremendous amount of pain and swelling, and actually we can cause some damage to the structures around the shoulder while we're doing that. The beauty of shoulder arthroscopy is that we can use tiny little incisions and then insert a device called an arthroscope and see in great detail inside the shoulder. And then through another little incision, we can actually insert miniature instruments and operate on the shoulder.
And you have you have one of the scopes here, right?
I do. So an arthroscope is an endoscopy device, and most specialties have some sort of endoscopy that they use today. Endoscopy is all done through fiber optic devices like this. Now, with the arthroscope, arthro means joint and scope means scope. So like a telescope, you look far away, and arthroscope, you look into a joint. And it's still got an eyepiece on it, and that eyepiece is connected to this fiber optic device that hooks up to a very high intensity light system, and then a high definition video camera attached to this. And so what we can do is we can take a shoulder. Now this is a model of a shoulder, and here, this is the shoulder blade here, and here's the little socket in the shoulder, here's the ball. Now I can take this arthroscope and insert it through a tiny little incision down into the shoulder and actually see inside the entire shoulder joint very clearly. And then through another small incision on the opposite side, I can actually insert miniature instruments and do the same operations that we used to have to do open.
Wow, so you're talking about just you barely can see where you went in after the surgery.
Exactly.
Okay, talk about the surgery itself.
Well, generally we do this as an outpatient procedure. In the old days when we did open procedures, generally people would have to be admitted to the hospital for a couple days just for pain control. That was a very painful operation. So if you ask anybody who had a rotator cuff surgery done 15 or 20 years ago, they'll usually tell you it was a very difficult, painful experience. Whereas now, we have the anesthesiologist give the person a shot at the base of their neck of a local anesthetic that completely numbs up the shoulder. And the nice thing about that, it lasts very long. It allows us to use much less general anesthetic when we put the person to sleep, so that there's less chance they'll get sick from it or have complications from the anesthetic. And then when they wake up, they don't have any pain at all, and that lasts for several hours, so their loved one can get them home and get them settled before they have any discomfort at all. And in addition, once the block does wear off, usually the pain isn't that great. So whereas in the old days we would have people that would have severe pain after shoulder surgery, now they're usually having maybe up to moderate pain. Occasionally severe pain, but usually not. So it's a far different experience than it used to be.
When are you back to normal? What about the physical therapy?
It depends on the operation. Some operations are just procedures where we go in and trim something up or take out something that's loose that's floating around in the joint. And those, basically, people wear a sling for a day or two and do some simple exercise, and the recovery is very rapid, and oftentimes they need very little therapy for an operation like that. But for something more sophisticated, like a rotator cuff repair, they might have to be in a sling for 4 to 6 weeks and then require sometimes several weeks or even a few months of physical therapy. The most important thing for any kind of shoulder injury or shoulder surgery is to get the shoulder moving right away. Because one thing about the shoulder is that it tends to get stiff very easily. So if we operate on a shoulder and put somebody in a sling for several weeks, you might as well pour glue on it because it's not going to move. So immediately, right away after surgery, we start the people doing just simple exercise to maintain their range of motion, but also exercise that are designed not to disrupt the repair that we did.
And get rid of the pain.
Exactly.
Quickly. Thank you, doctor.
You're welcome.